let's say that you do decide to walk down the gender transition road as an adolescent female. You can look forward to a high that's generated by testosterone, and maybe that's something short-term and positive. But what else can you look forward to?
Well, I suppose the next, what can you look forward to?
I'm being,
you get the high, facetious. Gotcha.
Yes.
Well, so the testosterone delivers that, but it also comes with risks. I don't know if you want me to talk about those.
Yes, and also the experience. You talk about voice deepening and hair development, right, and all of right. Walk through it. Walk through what happens to a person if they go down this road.
In the first few months on testosterone, at 10 to 40 times what a young woman's body would normally experience, her voice will change and masculinize. That does not seem to go away. Her facial features will change. They will round. Her shoulders will broaden, and it will redistribute fat. So if she's concerned about her fat, all of a sudden, in the places women develop fat, belly and thighs, all of a sudden, wow, she's lost weight and she can develop more muscle. The problem is that a lot of these changes are permanent. The masculinization of the facial features and whatnot, and also that comes with very big risk of cardiac arrest, and cardiac risk seems to be much higher than a woman would normally experience, even more than a man would normally experience, it seems.
And you also discuss the effects on fertility and sexual pleasure.
Right. Right. So vaginal atrophy and uterine atrophy occur. It can be quite painful. And so in some cases, making intercourse impossible if there's enough atrophy. It's quite painful. And because of the increased risk of endometrial cancer, doctors typically recommend at 5 years on testosterone a prophylactic hysterectomy. So even assuming that the testosterone doesn't impact her fertility, which it may, the hysterectomy certainly will make that impossible. Those are some of the risks of testosterone, but the biggest risk of all, of course, is that we have no idea all the long-term effects of what testosterone at 10 to 40 times what her body would normally happen will do to her.
Right, and that's a long-term course of treatment.
Right, because she can't go off it. Because if she goes off it at any point, she will go back. Some of her changes will revert. She'll go back to an in-between male and female look. So once you start, you become a permanent medical patient, and we just don't know. We don't have enough evidence of what will happen. To this patient population, all the problems they will incur in the long term. Then, of course, there's double mastectomy, which is the only cosmetic surgery or considered cosmetic surgery I'm aware of that you show up without a mental health professional's note. Even as a minor, you can have your breast removed. It destroys biological function. Obviously, it destroys all capacity for breastfeeding as well as erotic function very often. And yet, it's
and you
treated.
Outline some of the potential side effects of that as well. I believe monthly engorgement of breast tissue and leaks and that sort of thing as a consequence of only partial removal of the breast tissue. If I got that right?
Right, and whether the testosterone is enough. I mean, if you go off testosterone, your breasts may refill with milk even after they've been removed. You may have some drainage problems. I mean, drainage is another side effect that often happens. Very often women are unhappy with the look. They want a second surgery to repair the look of it.
And why are they unhappy with the look?
Because they're chasing an asymptote. They're running after a horizon. The final look of being a man, which is always a little bit out of reach. I mean, some of the people I interviewed for the book were forensic anthropologists because I wanted to know about skeletons. Are there skeletal differences between men and women? And it turns out there are. Even the sloping of the forehead won't be quite right. They'll be smaller. They'll have smaller hands. They'll have differently shaped pelvises. No matter what other surgeries they get, their femurs will attach differently for a woman than they do for a man.
Right, and that accounts for the difference in gait. And there's a difference in angle of the forearm connection to the upper arm as well, because of the difference in hip to waist ratio. All these subtle differences between men and women. It's hard enough for a man to be an ideal man, much less a woman to be transformed into an ideal man. And if you're an individual who has some questions about the acceptability of your physical appearance, then you can imagine that it's quite likely that that's going to be maintained as you make the transition to another gender.
Right, and there's something else I asked one of the doctors about, because I started looking at many pictures of the young women who had received a double mastectomy, and I noticed something. I said, wait a second, look at their hips. They have women's hips, which become even more obvious once they've had their breasts removed. So, the doctor said to me, that's right. There's another surgery they can get if they're concerned that their hips are protruding too much. So you see that this is not an easy fix, and yet it's being doled out, quite casually.
Right, and by casually, you mean that there's no screening in place, essentially, to stop women from beginning this transformation process. And that
right.
Also, you point out that so many medical health insurance schemes, like those provided by universities, now cover the testosterone, certainly, but also the medical procedures themselves to reduce their cost to a point where they're much more accessible than they would be otherwise.
That's right. I talked to a woman a week or two ago whose daughter suddenly decided she was trans at university. She was at a very top American university, and at university, she not only started a course of testosterone, but she was able to get her breasts removed.
Yes, well, that would be rather shocking news for any parent to contend with.